So, hello, Dr.
Okay.
Ayush. Seeing you after a while. It's been almost, I think, more than a year now. So, welcome, friends, to this video. This is a special video. I have with me one of my seniors from AIMS Delhi. He did his residency in pediatrics at AIMS Delhi and now is currently working as a resident in child neurology at Norton Children's Center. And I welcome you, Dr. Ayush, in this video. And through this video, we want to clear some of the questions that you might have had during, if you're trying to prepare for USMLE, or in a doubt whether you want to go for USMLE or you want to do your PG at AIMS or at from India. So the first question I'll ask myself. So Dr. Ayush, you have cleared both. You did your MD first at AIMS Delhi, the best college in India. And then subsequently, in a short span of time, you clear all those steps of USMLE and then started your residency in the US. Which out of the two is more difficult? You felt as more difficult for you, clearing AIMS or clearing your USMLE?
So for me personally, I think USMLE was a different journey because AIMS is like very difficult to pass in terms of writing that exam and clearing it. But USMLE is way more different. It's like you don't get qualified just on the basis of your scores, which are important, by the way, but you also need like to have, some personality. They will judge you based on not only your scores, but also how you can interact and how you can fit into their program. So it's a little bit more challenging, but if you like compare in terms of statistics, I guess AIMS will be difficult because the numbers are so huge, but
the percentage,
I feel like
the percentage of the people who get selected, maybe 1 or 2% of the applicants are chosen for a residency at AIMS. So I'll be asking questions that many of the viewers actually posted in comment sections. And I'll start with a broad question. What do you think are the advantages of residency at US? And the second part would be, what are the disadvantages of residency at US as compared to India?
So I would say in terms of advantages, it's more of like the quality of life. If you're doing a residency in US, you have a little more flexible schedule. You pay more attention to wellness, and you have a lot of avenues for research. So that's my top three things that I really liked about this. In terms of disadvantages, I would say you have to rely a little bit more on data recording, especially you have to use the electronic medical records here all the time. In fact, you kind of end up like spending around 20% of your time actually maintaining those records. The second thing will be, of course, you have a different culture that you have to get acclimatized to. And you also have to live a little bit away from your family. It's the distance. So those are the three top disadvantages, I would say.
So in terms of the amount of the hours that you have to put in work or the number of patients that you have to see, is it different from India? Because you have done your residency in one of the hectic departments at AIMS.
Yeah, of course. So here, you have to see patients from every perspective. You have less quantity and more quality. So it's more like, you are not taking care of them from the point of view of medical perspective, but also, for example, there's psychosocial. You have to deal with the insurance systems and other things. So that's the thing. But if you are in AIMS, like I did from pediatrics, so it was more of you are seeing like 200 patients a day in the clinic. So yeah, it is very different here.
Okay. So next, I want to know a few things regarding selection process. So what do you think is the ideal timing to prepare for USMLE? You did it after your MD. You did it quite rapidly. In fact, in a short span of time, you cleared your steps. What is the ideal time to start preparing for these exams?
So I honestly cannot tell exactly because for me, like you said, I did all the 4 steps in like a period of 6 months.
Yeah.
But typically, I think the best time to do the steps is like for the step one, it's usually after your first year or at the end of second year of your med school. And then the clinical knowledge section you can do around your final year, towards the end of it or in the middle of it, depending on how comfortable you are. They do not have clinical skills anymore in the
Okay.
process, but you have to have like the NCLEX exam, which is an English exam that you have to clear. I did not have the chance to do that, so I cannot tell about it, but I think this should be the preferred timeline.
And did you face any sort of discrimination, or maybe like you were the second choice in any place simply because you're an Indian medical graduate or not from the US itself?
Not at all. That was pretty much a very surprising thing. So the thing here is like it depends on which place you're going to work in. If you are in like the urban areas, like the major cities, and you're not working in community hospitals in rural areas, you are very less likely to have any sort of discrimination. That being said, I have heard a few reports, but it's always like, circumstantial. So in my program, I will say absolutely not, but it depends. But usually if you are on East or West Coast or Midwest, for example, I don't think you see any discrimination based on where you come from.
And possibly that's the reason why many of the leading institutes are headed by, or the program directors are from India in many places. So, and do you feel it makes a difference which college you graduate from? Say, if you did your MD from AIMS, someone may be from a state medical college. Does it make a difference in final matching process?
So, like I said, the matching process is not just about the scores. Like scores do matter, but it's all about your networking skills, your personality, how you can, portray yourself. So being a person who did some work in AIMS, it definitely puts you at advantage in terms of creating those contacts. Like when you are applying for USMLE programs, you need some form of clinical experience in US. And something called as letters of recommendation, which are very important for your application. So if you get letters of recommendation from US doctors, they are way more important than what you get in from any other like local institutions. So AIMS did help me, like I could connect to some contacts who were from AIMS, and they kind of helped me to get some experiences. But as far as which medical college you did your MBBS in, it does not really matter, because it's all the same for them. They don't consider if you are from AIMS or you are from peripheral medical colleges. But that being said, there are some exceptions, like if there are people who actually are from there, and a lot of physicians are actually from AIMS, so they might just prefer you in that way, but not otherwise.
Okay, now a few questions related to residency itself, besides the selection process. Do you think, at AIMS, we have seen such a huge variety of cases, even the rarest of the rare disorders and rare manifestations of common diseases, we've seen everything. So at your center, do you see such a variety? Because here we have more than 1 billion population, all neglected cases at times. We see diseases at there throughout the spectrum, at mild stage and at the extremes of its spectrum. We see that there.
So let me tell you, America is also like full of paradoxes. There are people who have the highest standards of care and get the highest level of, everything. And there are people who are underserved, who are minorities, who have the same cultural challenges and barriers to health-seeking behaviors. So it depends, actually. If you are in a big hospital, like I am doing my residency in a university hospital, and this is like a big center. So we have state-of-the-art program, we have cardiac transplant team, we have critical care cardiology, we have state-of-the-art neurology services, epilepsy surgery, literally everything. And that is very, standard here. So if you want to talk about state-of-the-art services, literally in every of the big academic centers, you will get all these state-of-the-art facilities, and you will get zebras, like we call the rare patients, basically all the time.
Okay.
But if you are working in a community hospital, which unfortunately a lot of international medical graduates end up in community-based hospitals, you might get more of, general practice sort of things, which might not be as complicated, but there are always like challenging patients. There are always, social challenges, economic challenges that you have to deal with. So this is
what I understand is that all colleges are not exactly the way we see in the research. All colleges are not the top-notch colleges. So an Indian graduate may land up in some peripheral center there as well. So it's not that you directly land in some of the top universities in the US. So from that point, do you think what is the comparison between AIIMS Delhi pediatrics department that you have had your training from to the center that you are currently working? How do they fare to each other?
So in terms of quality of services, definitely it's way ahead here. In terms of complexity of patients, definitely way ahead.
Okay.
It's like, so because this is a referral center, we have an area of coverage of around like 150 miles in the radius. So literally all the complicated patients, they land up here. For my specialty, which is child neurology, we have 14 specialists in child neurology, and each of them have their own like subspecialty which they work in. Okay. So in AIIMS there were only three child neurologists.
There were three or four.
Child neurologists, and they do general child neurology. Here it's like super specialized.
And what about the academic program? So at AIIMS, we both have seen like daily rigorous academic activities every day morning, or sometimes even in the midday. So how is the practice there?
So sorry, is it am I visible?
No, yeah, you're visible now. Yeah, carry on.
Sorry, I don't know what happened. So yeah, academics is very important here. You have to do mandatory credit hours, so you get credit for each of the conferences you attend. From my pediatrics years of training, you are supposed to be in noon conference. There's a protected time between 12 to 1, where you might or might not have lunch offered by the program, and you are supposed to sit in there and attend the conferences. That happens every day from Monday to Friday. And then when you are in inpatient services or critical care services between 8 to 9 a.m. daily, there is like committed time where you will check out your patients to your attendings from overnight teams, as well as you have a 30-minute off teaching period where something or the other will be taught to you in person. So that's besides the clinical care, when you get more teaching and didactics. And then you have to there is a certain amount of questions that you have to do every month to make sure that you are at par with the program, and they test you every year.
And one last point which I would like to know is that, see, at AIIMS, we see, as you yourself said, 200 patients a day. So we do many procedures. Maybe, what do you think with respect to clinical skills? Are people who work in central institutes at AIIMS, in India, like AIIMS, PGI Chandigarh, how are their clinical skills? I feel they could be better than someone working in a center at US who is more dependent on other specialties for performing those skills. See, for example, we have both worked in PICU at AIIMS. We used to do almost everything we never seek like help from other specialties. We used to do it. In comparison, someone who is at US getting help from so many other specialties. So what about the clinicals?
So I will say it depends. For example, we don't do venipunctures here. It's the nurses, they do it. They have line teams and line nurses who will place big lines. And as far as central lines are concerned, it's intubation is concerned. If you are interested in doing, for example, critical care, you can get tons of it. Like there is always a scope for you to do it. But we do have procedure rotations and things like that, but that does not match your clinical proficiency you get by training when, for example, doing venipunctures in your AIMS department where you see several a day. But that does not mean that you need to do that. Essentially, you are not going to do a lot of procedures here because mostly it's covered by, if you're an intensivist or ED physician, you definitely do it a way lot.
So maybe
number,
the job is well stratified. It's well given to a
right.
person who can handle it in the right fashion. So I think this is
Exactly.
what we use. What I think we should discuss in today's video. Maybe if you're free in the subsequent sessions, we might discuss like other practical aspects, how to prepare for those exams. Or in fact, one question which many people have asked is, what is the total cost that it involves getting from India to completing all the steps and joining a residency at US? A rough estimate. I'm not asking you to calculate an exact amount. A rough estimate. How much would it be?
So for me, in my time, which was like 2 years back, it all took approximately, I would say $5,000 to $6,000. So it includes like $3,000 or $3,500, which is just the exams, and then ECFMT certification. And then you have to do some or the other form of clinical experience here. So you have to come here for at least 2 to 3 months to do that. So
that,
that's
additional
there.
expenses.
So
that
these
was
are the minimal expenses.
This was, in fact, a very good session I had with you. We'll see about subsequent sessions regarding the exact methodology, the resources that one needs to use. So thanks for coming to the channel, and thanks for guiding my viewers regarding their USMLE journey. Thank you so much. Thank you.
You're welcome. Have a nice day.
Thank you.
Bye.
Bye.